What's going on, everybody? Toby coming at you. And I didn't look this up, but today is Saturday the 23rd of August, and I believe that makes tomorrow, when you're seeing this, to be week 28. Pretty sure it'll be week 28 since I was discharged from the hospital. No, since my surgery on the 2nd of February. So, as I promised a couple weeks ago, I went through, explained to everybody how it went from Friday during my catheterization appointment to Saturday and to Sunday morning. Okay, when I was wheeled into the operating room and then boom, knocked out from the drugs, whatever, and then the next thing I did was wake up. So that'll be that video is right here. And the next thing I did last week was to point out. I did a search. I pointed out 6 things that were important to those people needing to in recovery mode after getting through experiencing an open heart surgery, a CABG, or just open heart surgery in general. That video is up here as well. Yeah, I think it'll be up here. So this week, what I'm going to talk about, continue on with, is the experience of the surgery. So this is going to pick up from Sunday when I woke up, and I'm going to talk about how that went, my experience of how I woke up, the things that were involved every day as best as I can remember, to the point where I was discharged. Okay, so that would be my surgery was on Sunday. Or Sunday morning. I woke up Monday morning, and I've got a lot of notes here because I did take a lot of stuff, and I want to make sure I reviewed with Kylie to make sure that I wasn't missing anything, or she threw in some good perspectives too. But surgery was Sunday morning, and I woke up Monday morning, and then I was discharged the following Saturday on the 8th, which was the day before the Super Bowl. It's kind of my landmark event to know that's when I was discharged, the day before the Super Bowl. So anyway, as I said, I woke up Monday morning. I keep saying Sunday. Sunday was the surgery. I told you all that. It wheeled me in there, knocked me out. I woke up with an extremely raw, cold, hurt, painful throat because they intubated me. They had the oxygen or whatever, the air down my throat, my nose. No, they just had, I've showed you all the picture, and it was also, I'm probably using it as a thumbnail. I had oxygen here, and the way it was going, it was just, I could have sworn they had intubation on me, but either way, they did during the surgery, and it felt raw, and I just remember waking up very suddenly, and talking with Kylie, I wasn't sure what time I woke up, right? Who knows? You're kind of disoriented, very much so. Woke up in the bed, and the next thing they do is they come in, they calm you down, and they try to, anything that was needed to keep you, like the drip or whatever, they basically got me calmed down. They said, hey, you're fine, you're stable. They kind of briefed me on what was going on, like in that moment, and they said, the next thing they were saying they wanted to do was get me up and walking. How do I know that? Because I woke up, I think, between 6 and 7 o'clock Monday morning. The reason I say that is because Kylie and the kids came in at 8 o'clock right when the visitation hours started. And I was already up and walking. So what they did was, so that those of you that understand what to expect for when you do this, I was not feeling it. First of all, when you first wake up, they're like, we want to get you ambulatory, we want to get you walking. And I'm like, I want to stay right here. I'm uncomfortable. Can you lay me back, flatten the bed out or roll it up, whatever it was. Somehow I can remember I wasn't feeling that comfortable. They said, no, we need to get you up and walking. So They weren't rude about it. I got to make sure I say this throughout the video or whatever. Every time I interacted with the staff from this point forward were incredible professionals, very friendly, very helpful, very encouraging. And so they really, because, okay, so I have the incision here at the time, right? Fresh, less than 12, 24 hours at most, fresh. I've got tubes. I've got a tube and wires that are in here in my gut, right down here. I've also got a neck catheter coming out. I've also got a urinary catheter coming out. And plus I've got EKG wires plugged up all over me, measuring heart rate monitors, all that stuff. I've got all this stuff on top of me, okay, all over me. They were really good with, they helped me sit up, and they did the whole count thing, right, where they, 1, 2, 3, and they helped me shift over and put my legs over to where I'm hanging off, sitting up like you're sitting up out of bed, right, when you're getting up in the morning. And so what they did was they gave me a pillow that I have had to this up to even now. I have it upstairs in the bedroom, but it's a pillow that they should be giving any patient after you come out of the surgery. So the intention is that you hold that pillow and hug it, one for when you're doing these kind of activities, but also you're using it for when you're coughing or sneezing, and then you feel that coming. It takes, I'm telling you, use that pillow. It takes the shock, it absorbs some of the shock of the cough, the sneeze, movement from your chest and away from your lungs and rib cage. I don't know how, but it does, and it was awesome. So what they did was I put the pillow on my chest and I hugged it, and they actually, I'm trying to remember if they used the heart. It was a heart-shaped pillow. That's the cool thing about it, right? You metaphorical, it's a heart, literally. And I'm trying to remember if they used the heart or if they used just another pillow they put in front of me, and they put a belt, one of those hospital belts, around my chest up here that kept the heart close to me, or right here by my chest. I can't remember if it was a regular pillow or not. But anyway, and what they did was I held the pillow, and as I'm getting up off the bed, they're helping me. They've got a hold of the belt, and you got another person over here that's holding my back here, right? And they just start. You count 1, 2, 3, and on the third one, I stand up, and they lift me up to where I'm standing upright. And the crazy part about it was, after I stood up, there wasn't pain. I was just standing there. I was kind of stiff and sore, right, from going through that. But most of the pain was from sitting up in bed and then having to shift over to where my feet are hanging off the side of the bed. So what they did was, they got me up, standing up. They put a walker in front of me, and they hung all of the stuff that was strapped to me or that was plugged into me. They hung all the monitors and the bag and everything else. They hung that on this walker, okay? And they said, you can hold the walker as you need to. If you don't need to, you don't have to. And me being the stubborn ass that I am, I initially started walking with it, but it was a roller, kind of like you have wheels in the front and it's legs in the back that are rubber stoppers. And I think I remember walking a little bit, holding it, but in my brain, I'm thinking this is getting in my way. So I started just saying, hey, I'm gonna hold like this and walk myself. And so one of the assistants would just push or pull the walker with all the stuff hanging in front of me and pace with me. And every time I walked, the goal was, if you've ever been in the ER nowadays, it's usually a bunch of rooms, right, on both sides of the ER, and then they have that massive island-style nursing station in the center, right, of that department. same kind of concept. My goal as a patient, every goal as a patient in cardio like that, is to walk at least a lap around that nurse's station as far as you can. They don't push you to say you need to get all the way around. They don't. And there's actually I think a divider, and they had two sections, if you will, in a middle area that was probably so they could move in and out more freely to get to rooms and all that. And I remember they said you can cut through here and you walk it as much as you can. We just need to get you moving. And I was like, the hell with it. I'm going to keep walking. And I walked around, and they said, are you good? I said, no, I want to do another lap. So I walked another lap. And that's why I know Kylie got, and the kids got there at 8, because she said I was probably 10 feet from the room entrance, and they had walked, my son and my daughter walked to my room entrance and looked in the room, and Kylie was like, she was shocked. She's like, where's Toby? Where's he at?
All three of us were freaked out.
All three of them, I guess, were freaked. Yeah, she just got home. But they were freaked out, and then they saw me.
Dad!
Was that Rebecca? And my daughter Rebecca was standing there, and she sees me, and you heard Kylie maybe over there, but Rebecca kind of freaked out, was like, Dad, and so that was a motivating moment for me as well. But so that is what I think is defined as ambulatory. They want to get you walking, where you are walking unassisted, okay? Throughout the course from Monday when I woke up all the way through Friday and Saturday, I was discharged on that Saturday, they wanted me walking at least 2 times a day, okay? The other hard part about it was that when you're in your room, they wanted me eating in the chair. You got a bed and you got a chair that can recline a little bit. Basically kind of like an easy chair, right? I think it could actually also recline all the way back to a bed type thing in case you have a guest that's staying, your significant other, or wife, or a parent, whoever's with you is staying overnight with you. I think it did, but in my case, I would recline my feet on it. But either way, regardless what all its capabilities was, they wanted me to be in the chair when I'm eating. They wanted me to get into that practice, ambulatory, to be able to get up out of bed. And for Monday, and I cannot remember when it changed, but I know for Monday and for probably Tuesday, I had to have assistance with them lifting me up, getting out of the bed to sit down in that, and once I got up, I could go over and sit in the chair gently, carefully on my own. And then they'd have to put all the monitors and everything, fixate and station those things around the chair for me. So they're really cool about that, okay? Chair when eating, walking. I got 3 meals a day, and you will too in the hospital room. Bathing, I think I had, they were bed baths really, washcloth baths really. I think I got 2 or 3 of them, not every day, but every couple of days. And it was just 2 nursing staff members who came in. Maybe they weren't nurses. They might have been technicians, or who knows. I don't remember. But they clean everything. So, not to put too fine a point on it, I got a little nervous a couple times there because, you're always wondering, they weren't males. So when they're cleaning, you're kind of nervous about, the underside, the cleaning my junk, whatever. So I'll just leave it at that. You got bathed, washcloths, soapy water, full body. I think they might have left the head alone, but either way, full baths. Once I was standing up, bathroom, getting to that was simple. Not simple. It was a work in progress. So you had to have all the machines around you, but they were more than happy to come in there, help you, get you up. You stand up, you walk to the bathroom, and then you shut the door or leave it open, while you're trying to go. For me, I can tell you this, and this would probably be for anybody, right? Because they've got you on, I do remember this, they had me on some kind of a painkiller or something from Monday or through Sunday probably and Monday through until probably Wednesday or Thursday is when they took me off of them, because that particular medication intentionally, was to prevent you from having bowel movements. Okay? So I was still, and forgive me, bathroom, I take that back. Let me redo that. Let's say it again. I wasn't going Monday through Tuesday, Wednesday, Thursday. They took out the catheter, the urinary catheter, on Friday. So I was still going to, I think they still had me going to the bathroom or trying to go to the bathroom, even with the urinary catheter in, so that I could try to have a bowel movement. Their number one standard of, I guess you'd say, progress as far as patient discharge from the hospital was having a bowel movement. That was something they said, you have to do that before we let you out of here. So I also had, I think I remember physical therapy coming in. They definitely came in a few times because I had these things like socks with pads that were strapped to my feet, and they were the pad things were like electrical. They were not bad, motor operated, where they would they had built-in rollers or massagers in the bottoms of the feet, so they would go across your feet at the bottoms like this on a routine massage and I don't want to say masseuse. Misogynistic just doesn't sound right. It sounds like something out of Criminal Minds. So, in a massaging way, okay? And it was meant to keep your feet from, I don't want to say atrophy, from going from muscle, and it was that part atrophy, but from cramping and bed sores and swelling and all that kind of stuff. It was to keep blood flow going. And then they would also come in occasionally to check on my swelling on my ankles, my thighs, and my calves for that purpose as well. And I was also on a water pill, so they were checking on that. That's what part of the therapies were. Over the course of the time that you're in there, at least, while I was in there, I will say this. Some of the stuff, y'all, that I've expressed to you so that you can possibly know you'll go through or experience some of this stuff might be unique to my experience. I don't know. I haven't done more than one heart surgery in my life, so I'm not planning on another one. But I know that the last bullet here, this other bullet here, is what's triggering this statement. Is I put moving rooms, okay, from the patient recovery room that was I first woke up in after surgery. I went to another room, and I'll get to that in a second, and then another room before I was finally discharged. Okay, so I don't know if you'll end up going through that. You might just go, it sometimes, if what I understand, it depends upon patient triage level, patient recovery speed, and bed space, right, in those particular wings that they want to move a patient to. So let me go from there to, okay, we'll start with this one. So on Tuesday or Wednesday, thank you, shout out to my boss. He coordinated with my wife. He came by the house, picked up my CPAP machine. I've discussed the CPAP in previous videos, but if you have a CPAP machine and you've been without it, especially like in a hospital setting, you don't know how nice it is to have that until you have it in the hospital. He brought it by, I think I said either Tuesday or Wednesday. I think it was Tuesday. Tuesday is when he brought it by. Yeah, Tuesday evening. I even made a note here. Hello. Tuesday evening is when it was dropped off. I was asleep, did not see him. When I woke up, the CPAP machine was sitting on a like a table or nightstand or something, or a table for me to. And like I said before, they brought it out, they set it up, put water in it, distilled water, and they fitted it with a hose so that it would go into the air oxygen monitor for me, so that while breathing they could monitor my oxygenation levels as well as allow me to breathe. And it was awesome because the only other option was a full-on mask over the face. I've said that before, and I wasn't having it. I didn't like that thing. That I have nasal pillows for my CPAP machine, and they work great for me in my opinion. And since I wear it, it's all that matters. Kylie came, like I told you, she came Tuesday or Monday morning with the kids. They hung out all day. They were there all day, and then Kylie was she was kind of at the beginnings of feeling kind of rough, and then she left that evening, took the kids home, stayed home, and then that feeling rough got the better of her, and she was at home all the way through until Friday, and she came up Friday and stayed Friday night and with me all day Saturday until I discharged on Saturday. And I would give a huge shout out to her on that, but she's over there, and
I can hear you.
I know you can. That's the reason why I don't know about anyway. So I'll say it publicly here, okay? This woman busted her ass for me. Yes, she's my wife, and yes, there's a choice there. And she was pushing so hard against herself, on herself, and putting so much pressure on herself to make sure friends and family were updated and taking care of our kids. One is off in college. They surprised and brought him home for me.
Your mom did that.
Well, the point is you coordinated part of this.
I didn't know about it.
Okay, so you still brought him back from the hospital back to the house.
Yes.
So, see, she hates taking credit for stuff. And she pushed herself too hard. She came down with some symptoms and did not want to put me at risk, so she stayed home, and that was hard for her. I can imagine. I can only imagine that. So, huge shout out to my wife. You can hear in the background all the stuff she's saying. Put it in the comments, because I'm trying to get her to have the courage to the metaphorical balls to get on the screen here with me, and she won't do it. She's camera shy. I get it. She don't want to talk. I've asked her to help me with notes so that she can help me remember this stuff. So to go back, as I said earlier, I was in the recovery room after the surgery on Sunday and Monday morning, and that's where the picture is from. Like I said, I'm using that for the thumbnail. I was in there Sunday, from the best I can tell, because I show you the homework, guys. So I went into my cell phone and scrolled back between my wife to the time after the surgery to try to get a better timeline of when I sent pictures of like the room numbers and all that kind of stuff, right? And the communication I had. So it looks like, to the best that I can remember, I was in one room Sunday for the surgery, or Sunday after the surgery to Monday, and then Tuesday and partly Wednesday I was in the recovery room. It was kind of a Tuesday, Wednesday gray area there, like it was Tuesday evening into Wednesday night or something like that. And then Wednesday I was moved. Tuesday, what I think I see here is, yes, my notes, I know. It looks like Tuesday night I was moved. And so Tuesday and Wednesday I was in the next room up on the 5th floor. That was what I've labeled here as the first room. The recovery room was where I woke up, and then the first shit change room was the other room. And then Wednesday, Thursday, Friday, and Saturday they had me in the second room, and that was the final room from where I was discharged. That's why I say I don't know if you'll be in that kind of situation, guys. That experience might be just specific to the Jewish hospital I was in. It might have been, again, based upon bed space, procedures of the hospital. I don't know, but just be prepared for the room that you wake up in from surgery. may not be the room that you stay in. And they told me that from the beginning. They said this is just where the patients recover initially from. Once you wake up, they change you to another room that usually you're supposed to stay in until you're discharged, depending upon your physical healing and recovery, how you're progressing. And I covered this earlier. I put Thursday here. Oh yeah. So Thursday was when they removed my wires that were down here, some of the wires and the tubes, except for the urinary catheter. On Thursday, they removed everything except the urinary catheter. And on Thursday, I guess, was a bigger physical progression day for me, because that's also the day they said, or that I walked once in the morning, once in the afternoon, and also sat in that chair all day for the majority of the day. I told y'all, I have not yet been able to do a video, I don't think, of this where that has not gone off. Friday morning, and again, as I keep saying this, but this is based upon my experience. Your experience or somebody else's may be different. If yours was and you remember the details, put in the comments below. On Friday morning for me is when they removed my urinary catheter. And so here's the other tip of that. Friday so that would have been the 7th of February, the VA called my wife here at the house, or called her on her cell phone, to start setting up and putting in place, scheduling the home health services. And they told my wife that Jewish Hospital told them that I was going to be discharged on Saturday. So she knew the actual official quote kind of day before I did. She was ramped up on text messaging. So, also Friday was a pretty busy day for me. So also that happened on me on Friday. They did an ultrasound on my lungs, and the ultrasound showed that I still had fluid in my lungs. And when they took me in for that ultrasound, they made the decision right there on the spot to remove the fluid immediately in the same room. And what that involved, there was no local anesthetic, there was no drugs, there was no pills to make me drowsy. Y'all, I still remember that. They basically rolled me up on my right side, and Kylie wasn't here yet. She was on her way up, or planning to come on up, and I really, nobody except me knew this, for what they were telling me. She's right there now, by the way. But so they rolled me over on my right side, and they said, the doctor explained what they're going to do is they're going to push a hose, I think it's some kind of a hose or some kind of a surgical instrument, like a vacuum tube basically, and they had to be very careful, of course, because they don't want to go in and hit that vacuum in the inner walls of my lungs. And they pushed it through my skin in the back, right back here, down into the lung directly. Like I said, there was no local anesthetic, I don't think. There might have been one just for pushing in here, but they pushed that in, sucked out the fluid, and then pulled it back out and did an ultrasound and confirmed that the fluid was removed. Now, I want to use this point to bring up an extremely important thing for you, okay? When you get finished with surgery and you're out and you wake up, one of the things they're going to do, they're going to give you 3 things. They should be giving you, again, different hospitals maybe, but everybody that I've talked to or messaged with or whatever who said they had heart surgery has said yes. Everybody typically gets that heart-shaped pillow, okay? The other thing they're going to give you are the breathing tools, the breathing things to practice and work on strengthening your respiration, your breathing, and strengthening your lungs inside your rib cage. I had 2 different ones. One was to inhale with, and one was to exhale with. They asked me in the hospital, and y'all, they asked me in the hospital, make sure you're trying to do these on the hour, at least every hour, and try to do it 5 times per session, right? So 5 repetitions per session at least, okay, as best you can. And when you start out, it wears you out initially. You're also fighting the cough a little bit, okay? But they want you to cough. So you're kind of having that thing, that pillow holding on, doing the breathing and coughing because they want you to cough it out and force.
Hold your pillow.
So I cannot emphasize that enough, guys. When they give you those 2 machines, they told me, I think, and if they didn't, I would almost bet that my doing that, staying consistent with those machines went during my waking hours, during my stay there. If I hadn't done those things, that fluid removal probably would have been a lot worse and a lot more excessive. Okay, so make sure, that's one of the reasons why they said you need to make sure you're doing the breathing exercises, because you're also expelling fluid and mucus and whatever out of your lungs. So make sure you're doing that.
Also, I was just reading, it reminded me, one of the biggest things they kept telling me about, they will not move you. Is that better for you? They will not move you until your oxygen levels got up. And that was that sensor that kept going off when you were at the VA hospital and when you were, before you had your surgery. But it was because you kept falling asleep and you didn't have your CPAP. So the breathing exercises along with your CPAP, the proper breathing, would have, that all together, the breathing exercises all helped to get your oxygen levels back up, which was one of the key factors in whether they did move you or not.
Okay. Well,
Which I forgot about. That was a big deal back then. It was like, get his oxygen up, because the dang thing kept going off every time we turned around.
Yeah.
We couldn't breathe.
So you heard it right there. Oxygen, right? That was important. Bowel movement and breathing exercises and no fluid in the lungs and everything, right? As I said before, the bowel movement was the catalyst for me being discharged from the hospital. And then on Saturday, when I was discharged, it's like they came in the morning. They said, hey, it looks like today you're going to be discharged. If you've ever been a patient overnight or more nights in a hospital, you all know they'll tell you that in the morning, but that is usually an all-day process, okay? It is. Started late morning. They come in, that's when they removed the final catheter. That's when they moved the urinary catheter. That's when they gave me, the nurse came in and gave me the prescriptions that I was going to be taking for like the next 5 days to 2 weeks. And that's what they prescribed me. I showed you all in an earlier video, the hydrocodone is what I was prescribed. That was for as needed. And that was a 14-day supply. I think maybe twice a day as needed. But a nurse sat down with me and my wife and went through all the medications to make sure we understood them or what they were going to be. And I had to go down. Did we have to go downstairs and pick them up from the pharmacy? The initial, or was that the one we swung by Walgreens to pick up? I don't think she's in there anymore.
I'm thinking, I think they brought meds to you. We didn't have to go to any pharmacy.
Okay, I thought they gave like an initial, and then we had to go by, because we did have to go by there the first time to pay like $6 or $7 per bottle or whatever it was.
They gave you enough to get you by a few days.
Yeah.
We didn't.
So they explained the prescriptions to me. I don't recall whether I got another bath. I want to say I thought I did get like one more rub down or clean up before getting, getting dressed and all that stuff.
You did, because they showed me how to do it.
Okay, so, and that was huge. And that's going to be in another video for you all. For those, the next video we're going to do about this stuff, y'all, from the experience perspective, is I'm going to go over with you how things went, our daily routines for the first, February and March or so at home, okay? Talking about the cleaning of body, how Kylie and I her bad acidness helped with the dietary lifestyle changes, how I was sitting and mobility around the house. I'm going to cover that stuff. So I'm going to explain to you how I showered and how we did the cleaning of the incisions and everything, the healing stuff. We'll get into that in another video. But so they disconnected the EKG. They took all the probes off of me. And that was pretty much it. The only big thing about it was you have to have somebody with you when they discharge you, because they have to wheel you out in a wheelchair. You're not allowed to drive. And with a heart surgery thing, you're not especially not allowed to drive the day of. Some have gotten on here and chimed in saying, depending upon how they were sewn up, whether it was like a hard plate seal up fusion or if they were sewn up, that they were driving within 4 or 5 days after they were discharged. That's cool. I don't know if that's exactly the right number, I remember, but the key is you're not allowed to drive when you leave the hospital. So I had to have somebody else drive. My wife drove, and we got home around 3 p.m. on Saturday afternoon. So at least that's what the Google timeline showed. But yeah, y'all, that was pretty much how the week after the surgery went. I'm trying to think of any last piece. I can also tell you this. When I woke up, Kylie said they came in just as I was finishing the second lap, and then they brought within minutes after me getting back in there and sitting back down in the bed or on the chair, they brought my food in. That was probably a breakfast meal or whatever. And I can remember I had maybe a bite or two. It might have been a little more, but it wasn't much more than that. I had no appetite and no strength. So I can tell you, for the first 12 to 24 hours after you wake up, they're spot on with bringing their meals. At least they were at Jewish Hospital. Had somebody come in, ask you what you wanted on the menu, breakfast, lunch, or dinners for each one. They usually will go in and ask you for breakfast. Let me back that up. They'll bring you your breakfast. At lunch, or they'll ask you what you want for lunch, and at lunchtime they'll ask you what you want for dinner when they're delivering it, and then at dinner time they ask you what you want for breakfast. It's roughly something like that, okay? But I hardly touched my breakfast. I really don't recall eating much for breakfast, lunch, or dinner. I probably had a little bit. Do you remember, Kai? Was you on breakfast?
Which day?
On Monday, when you all were there.
Maybe that breakfast tray sat in front of you for most of the day.
Okay, so there you go.
You didn't touch
There you go.
nothing.
Yeah, so,
You took a couple bites of eggs and that was it.
like I said, she said I took a couple bites of the eggs and that was about it. That tray sat there for most of the day. So I would tell you all, again, everybody's different. Everybody's experience, everybody's diet, everybody's hunger and all that's going to be different. But anticipate having very little appetite for the first 24 to 48 hours or more after you wake up from surgery. Okay, just kind of be prepared for that. Don't be surprised and don't be worried, stressed out if you're not. If you do have a loss of appetite, it'll come back. I promise you. By midway through the week, I was chowing down on that hospital food. It was pretty good. So, other than that, I don't really have anything else to add. If you all have any questions, as always, feel free to comment below. Feel free to share your experiences. If you have any questions, you can reach out to me on Instagram, Facebook, whatever, in the comments below. Aside from that, thank you again to everybody for watching and listening and asking questions and commenting. I appreciate the support. Really, really do. It is encouraging. It's inspiring. Thank you. Until the next video, love y'all. God bless you all. Take care.